more about this. I think it's a great topic. It's really changed my life, and I'm learning as much as I can to be able to provide this support and intervention to other people. So I had a lot of questions that came up through either some comments or people reach out to me. I thought I would just start with some of that, and then we'll get into the actual training. So first thing is the research. I did not spend a lot of time last time on research because you guys got all the links. And so I want to know if anybody had a chance to actually go and do any of the research. You can just thumbs up or whatever if you were able to actually click on any of the links. Okay, well, there you go. Something you can still work on. So the reason I didn't go into a lot of detail is because there's so much there for you. And everybody has kind of a different viewpoint as far as um, what they're looking for when they're looking for research. They're looking for, hopefully the empirical evidence. As most of our interventions that we use and approaches and theories, as you guys know, most of the research, as long as it's been proven to be empirical, will be very similar. And I think somebody had reached out about how this could be similar to like mindfulness research. Absolutely, that is 100, and that's what we want. You want it to be where it would yield the same kind of results as other acceptable interventions. So, but I'm going to let you guys do your own research into that. I'm sure Gabby's going to share that link again, so you'll have it this time too. There's a lot out there. So please, as we're going through this, weeks from now, if you have questions and you have a chance to look at that, just reach out to me, and I'm happy to go into more details about any of that stuff. The next thing I want to just kind of address is the application. Got a ton of questions about this. Am I allowed to start doing with his clients now? And the answer is yes, you are at your comfort level and their comfort level. I'm going to talk a little bit today about the trauma and how really, if a client has trauma, you shouldn't be doing this yet, right? And I'll talk a little bit about that. That requires some more advanced training. But if you want to try it with a client, let's say has some anxiety or gets frustrated about something like, so an example might be that every time they bring me my food, it's cold. And I get upset about that, right? And I feel like I don't have any control over that. That would be something great to work on with your client to see. I would start with something very small and then just take it gradual. And I'll talk a little bit about some of the flooding that might happen if you take it too soon. And we don't want that to happen. We want to take it very, very small as you're using this as an intervention. It's much like some of our other interventions, like the stop. Most of you know what the stop is. It's not, that shouldn't cause more harm to somebody, but everything could. It could make the symptoms worse, right? Because you're making awareness, you're actually paying attention to it. So just keep that in mind as you're trying it with clients to make sure you always have their safety plan, a backup plan as something that has helped in the past for them when you're trying a new intervention like this. All right, now I'm going to dig in. I guess we'll go ahead and do that poll now, Gabby, if you don't mind launching that again. If you guys can go ahead and answer this poll, please. All right, so do you guys see the answers on the screen? Oh, good. So you'll see, there's less people that thinks it's woo-woo than last time. So you guys were there at the training we did last time. It was the same exact pool. I wanted to kind of see if there would be any difference. I love that 63 of you have tried it. And that is right, because you tried it in this training last time. So great. I appreciate that. And then we still have one person that uses it on a regular basis. And some have heard it but never tried it. So hopefully after today, you will say you've tried it. Let me go back to Can you see my screen? Gabby, just do a thumb.
Yes.
Yes, thank you very much.
Can
Okay,
you move whatever you have on top of it a little over?
I'll try. I know this happened last time. Is that better?
Um, you will want to,
Here, I think I remember now. That,
yes, there you go.
okay, perfect. Okay,
Uh,
again, reminder, this is the EFT, which is Emotional Freedom Techniques. And that's what we went through last time. This is, again, part 2. So again, I'm Ann Nash. Sorry, I didn't do a good introduction in the beginning. I'm the Vice President of Behavioral Health for ViaQuest Psychiatric and Behavioral Solutions. I'm also a EFT personal user, and I'm also going through certification right now under a mentor to become certified in EFT. Some of the objectives we're going to talk about today, we're going to talk about the generalization effect. We're going to talk about the application of EFT and those cravings I mentioned before, review some of the cognitive belief shifts that might happen, describe how EFT works with talk therapy to cut through resistant problems, identify how EFT can benefit little t traumas, and lastly, learn how to apply EFT to special populations, including animals. So we're going to talk a little bit about that. All right, so I did a little bit of review as far as some questions before, but I want to go through the basic EFT itself. So who feels like they can share with the group what they remember about what is a basic EFT? And because I hid everything, I can no longer see the video thing. So there we go. Maybe I can do it that way.
everybody is muted, so you will have to unmute yourself in order to speak.
I'm looking. Okay, I don't hear anything and I don't see any hands.
Tapping.
Awesome, Lena, thank you. Awesome. So the main elements of EFT, right, is we're first identifying some moment in time, a memory, something that happened, there was some issue, the present moment, right, that you're thinking about. And then you think about what was my emotion attached to it. And then from there, we think about, did it affect anywhere in your body? And so we think about those. So that's really basic. So what we do is identify that. And then we come up with an affirmation like, I still accept myself. And then we tap on the points and we remind ourselves of the emotion. And then the idea is that there could be a shift, which could be maybe a decrease in the emotion, maybe a change in how it's felt in your body, or maybe your mind starts thinking about something completely different. All those things are possible that can happen in the midst of EFT and basic EFT, how that happens. So those are the key elements of basic EFT, is just identifying those things and going through the points. All right, so practice. So I know many of you guys said you practice when we did the pool, but who is willing to share? Did you actually practice outside of the training since the last time we met? And you can just put your hand up, just do a hand thing to show that you actually practice, under the, whatever it's called, on your screen, just put your hands up if you actually practiced. I see Stacy's hand. Thank you. I see a couple of your hands. Thank you. I appreciate that. Awesome. Great. Great. I'm not going to make you practice. It's completely up to you. You have to, feel like it's worth your time to do that. I personally am a huge believer in it. But that's how you're going to get better. And there's never anything wrong with you self-tapping. Some people go through their whole lives and they never do the clinical aspect of this. They never meet with a clinician. They only do their own self-tapping. So if that's all you want to do after you get out of, that's all you get out of this is you want to do that, no problem. But I just encourage you to do that, encourage you to practice and get kind of familiar with it. So, all right, now I'm going to call on Wendy. Wendy, I know last time you were such a great volunteer and we did some tapping about you and some fear about a snake. Would you mind sharing a little bit, anything that's, any experiences you've had since we have tapped about that?
For sure. It's so interesting actually. So we did that when we did that in the last class that or the last training that we had. I experienced some physical things that I always have. When I think about snakes and stuff like that, there's always this physical feeling. Sometimes I'll start to stutter. I feel it in my body in different places. Like probably a true phobia, but I didn't actually end up going and mowing my lawn like I was planning on and thinking about. But I think it doesn't matter. Anytime I just even think about snakes, I would get really upset. And like seriously, I only did it and during that training. And it's just so interesting because I was able to since then watch like a really video with snake in it and stuff like that I wouldn't normally be able to do. And like when I think of it now, I'm not having a physical reaction like I used to have, but I have like I think there's part of my brain that still thinks that I'm supposed to be afraid, but I'm not having that physical because I'm like, oh, I don't like that. Like my logical brain is saying, like, oh, I don't like that, or it feels different. It's really interesting.
Yes, thank you, Wendy. I really appreciate so much your feedback. Um, Not expecting there to be a cure or anything like that that happens right away, but just noticing that there was a shift,
Mm-hmm.
something's different. I appreciate that a lot. So let me open it up. Does anybody have any questions of Wendy about her experience or just in general about EFT before we get going through the rest of the material?
We did have some items in the chat. Angela says I've been doing it regularly and it seems to be helpful. And Kim said, did you hear from Olivia? She let me know she tried the tapping and found it helpful, but she's on PTO today. So
Thank you.
I even changed my background for you, Wendy. I know the green grass. I was thought about you when I had my background today.
Thanks. But I mean, I really do feel different. So it like I said, I mean, I'm interested to see how it is long term, but it's very interesting.
Yeah. Any other feedback, questions, or anything like that? All right. Thanks, Wendy. All right, so now I'm going to get into, we're going to practice. So remember I talked about before about borrowing benefits, and that's when you tap along with somebody else and you're going to get something in return. So we're going to do a little bit of that today, but before we do that, I want to go through the tapping chart with you. So, and don't see the first one of this. Remember the side of the hand. So I want everybody please just to practice. All we're doing is just practicing these points. Doesn't matter how many times you do this. Usually it's like 5, but don't feel like you always have to count to 5, just however long that you're going to do each point. I had the other handout last time where it talked about you do this for a certain amount. And then for each point, you should do it for this amount of time. When we're talking about the meridian points, that's fine too. It doesn't really matter, in my opinion. And most research has shown it's not like an exact science how often you're going to tap on these points. So this is a reminder, when you tap on the side of the hand, you're also going to help before you do this, you would do this for yourself, or if you're working with a client, you help them identify a situation where they feel a certain emotion. Either they're upset about something, they're, maybe having some anxiety, maybe having some doubt, whatever emotion they could think about associated with their current thought about an event or their imagined what an event is going to be like. And then so you have them think about, okay, what emotion is that? And am I feeling it anywhere in my body? So if I say, okay, I'm feeling, let's say, I'm feeling anxious because it's a good one. I have a doctor's appointment next week and I'm thinking about what are the results going to be. So that would be, and I might feel it in my neck, and I feel this tightness in my neck. So, I would, okay, even though I feel anxious when I think about going to the doctor on Monday and I feel this in my neck, I still deeply and completely accept myself. So that would be the first part as you're doing this point. And then you go through the tapping points. So the first one is the top of the head. You can either do one hand, two hand, doesn't matter. You're doing the tapping. You could do 2 fingers, you could do all of your fingers, it doesn't matter, just so you're tapping the top of your head. And then the next point is the eyebrow. So right here again, 1 or 2 hands, doesn't matter, eyebrow. Then we have the side of the eye, and the side of the eye is right here, so side of the eye. Then you have under your eye, under your nose, your chin, your collarbone, and some people just do their collarbone like this. Whatever's more comfortable for you, you can do 1 or 2 hands. And then you have under your arm. So under your arm right here, and again, 1 arm, 2 arm, doesn't matter, just under your arm. And so that's the tapping points as we went through. So any questions about the tapping points before we move on? Okay, you guys are quiet today. All right, so now we have our setup statement, and you guys should have copies of these as well, and I'm sure Gabby will put them in the chat again for you as well. But again, our idea here is that we are going to find a specific issue. We want to make sure it's not too general, that it's specific to be able to target current emotion about it. We're going to measure the intensity. So this is where I know I was talking about, I think I used anxiety before. I would measure it on a scale of 1 to 10. How strong is it? Located in my body. And then I would acknowledge, even though I feel this about this in my body, then I do a self-affirmation, which is the most common one is I deeply and completely accept myself, but there's many variations you can do. So what I want to do now is I'm going to stop sharing and we're going to practice this. And I want you guys to do what I was talking about before, the borrowing benefits. So as we're going through and tapping with somebody else, you guys do the same thing. You guys verbalize it. So just be muted and then you will get some benefits from that. So it's really cool that works. So I have a volunteer in Beth who's going to be my volunteer. So if everyone could mute except for Beth. And Beth, thank you for being the volunteer today. All right, so let's start with, can you think of an event, something either that recently happened, is happening now, or going to happen in the near future?
When I feel really bad pressure in my ears and then it gets into vertigo.
Okay, so are you currently experiencing this?
I am not.
Okay, so when was the last time you did?
Probably 2 nights ago.
Okay, and can you think about when you may experience it again?
It comes and goes, so that's what makes it so crazy.
No, that's okay. So this is where it's your choice. We can either tap on thinking about what it was like 2 nights ago, or tap on your imagine of when it might happen again.
I think imagine when it's going to happen again.
Okay, so let's just imagine when it's going to happen again, and you think it'll be at night.
Yes.
Okay. And when this happens again, the event is feeling pressure in your ear. Okay. When you feel pressure in your ear, do you notice an emotion attached to it?
I feel really vulnerable.
Okay. And when you think about feeling vulnerable, what would you rate that on a scale of 1 to 10? Thinking not right now how you're feeling, but imagining the next time you experience this pressure in your ears.
It's like an 8.
Okay. And do you feel this in your body?
Yes,
Okay, where do you feel it?
in my shoulders.
All right. And what do you want to be your goal? What would you like to happen as a result of this?
That I can relax when I'm
Okay.
feeling that and not get more anxious.
So you want the vulnerability to go down to a 0?
Either decrease in the rating or in how long I'm feeling it.
Okay.
So I
And
would say how long I'm feeling it.
how long do you normally feel it?
About 2 minutes.
Okay. Great. So that's a SMART goal, right? You should be able to measure that if this is going to work. So good. All right. So, and the kind of acceptance statements, I deeply and completely accept myself. Are you comfortable with that?
Yes.
Okay. All right. So we're going to try this. And then as we go through this, if you feel like something isn't correct or you get the sense that it should be this way, just speak up and stop me and we'll correct. So, all right, if everybody else could do this along, just keep muted and then just talk as we go through it. You're going to get the most benefits by doing that. Okay, Beth, you're just going to repeat after me. So you can start tapping on the side of your hand. All right. So even though I feel vulnerable,
Even though I feel vulnerable,
when I imagine soon when I'm going to have pressure in my ears at night.
even when I imagine I'm going to have pressure soon in my ears at night,
In my ears at night, yes. And I'm going to feel this in my shoulders.
I'm going to feel this in my shoulders.
I still deeply and completely accept myself.
I still deeply and completely accept myself.
Good. I imagine soon
I imagine soon
I will feel pressure in my ears at night.
I will feel pressure in my ears at night,
And I'll feel vulnerable about that.
and I'll feel vulnerable about that.
And I feel that in my shoulders.
I feel that in my shoulders.
I still deeply and completely accept myself.
I still deeply and completely accept myself,
Even though I feel vulnerable,
even though I feel vulnerable.
I'm going to feel pressure in my ears
I'm going to feel pressure in my ears
soon at night.
soon at night,
And I'll feel it on my shoulders.
and I'll feel it on my shoulders.
I still deeply and completely accept myself.
I still deeply and completely accept myself.
Okay, we're going to move to the tapping point, so the top of the head. And just again, repeat after me. This vulnerability,
This vulnerability,
side of the eye. I feel vulnerable.
I feel vulnerable.
Side of the eye. I feel vulnerable in my shoulders.
I feel vulnerable in my shoulders.
Under the eye. This vulnerable.
This vulnerable.
Under the nose. This vulnerable.
This vulnerable.
Under the mouth. I feel vulnerable.
I feel vulnerable.
Collarbone. I feel vulnerable.
I feel vulnerable.
Under the arm. Vulnerable.
Vulnerable.
And I should have mentioned it before, but if you have a glass of water or something, so if you have something like that to drink, if you please take a drink of water. And then you check in. So Beth, tell me, is it still pressure in your ears?
No,
Okay, what is it now?
I don't feel any pressure in my ears. I feel my ear.
Okay, so when you think about soon, when you're imagining at night and you think about pressure in your ears, are you feeling that?
Yes.
Okay. So has that changed at all? Your thoughts about it? Anything at all?
Yes.
Tell me what's changed.
I don't feel like it's, when I think forward, it's an 8. It's more like a 5, 6.
Okay.
And I think like I have the ability to take time and relax.
Okay. And relax. Would you mind explaining a little bit more about that?
When I'm at an 8, I don't think of that as an option to stop and maybe be mindful.
Yeah. So when you're thinking of it now and you imagine the event happening, you can see that you might have time to stop and relax.
Right.
Okay, good. And so at this point, you can either have the person do it again and to try to get it down lower. You also want to kind of hone in to see if there's anything else that came up. Was there another, she talked about vulnerable. Is there another emotion that maybe came up that was more highlighted? So I don't know, Beth, if you noticed that shift or if it was still that vulnerable.
No, I have bad vertigo and I fall a lot. So sometimes the vulnerable precedes the fall. And so I
Yes.
hurt then
Yes.
physically. So, yeah. So the vulnerable really gets you going though. So,
Yes. Yeah. So then as you're doing this technique, what you can do is really try to help people identify other emotions too that might be more specific to that. So I'm not going to make Beth go through all this, but I appreciate it so much, you giving the example. It was very, very helpful. But normally, like I mentioned the last time, these sessions are like an hour. And we really try to have it where the symptoms are down to a 0 at the end. And that's the best, that's our main goal, is to try to get it down to a 0. So any questions? I'm opening it up. Any questions then to about this?
Know that when we're doing techniques, obviously there's conflicts of interest and, doing it with family or anything like that. But is this one of those techniques where there's a family member or a friend that's struggling that, we could feel okay with sharing this technique with them without being a therapist to them?
Yeah, I mean, I believe so. It's because the idea is that you talk minimal about, and like, I'm not like, as many of you probably thought in your mind, well, I'm going to really dig into what's going on with Beth. Like, does she feel anxious about this? Like, how's it affected her life? You don't do that with this technique. You keep it real honed in on as much, the detail in the moment as possible. And so you're not doing therapy, right? So that would be a difference, and
Right.
trying to learn the difference about that. So yeah, I do it with my kids and with and so we did this and she felt better and didn't feel as overwhelmed. And yeah, it might have been just the fact that she stopped, took some breaths, reflected on it, all that stuff. But the sequence of what happened in EFT worked in the moment. So, yeah, there's no conflict to do that. You just want to make sure you're not putting your therapist hat on, because we do that
Right.
easy, right? And keep it separate. So, but good
Oh,
question.
I've been told when I'm doing that. So I don't get away with that.
All right. Well, I'm going to go ahead and let me see how we're doing on time so far. All right, we did good. And again, thanks a lot, Beth, for being willing to do that. So, all right, I'm going to share again. And here we go. Here we are back to the statement again. And again, you guys have this handout. So this is really all you need, is to fill in where it is you have located the emotion, located the feeling, and then fill in, even though I feel this about this in my body, where I deeply and completely accept myself. And so then you go on and on with that same over, as long as you have those things identified. Generalization effect. That was one of the objectives in the beginning, to talk a little bit about this. So the EFT process, what we do is, just like I was telling you guys about how things could change as you're going through this process, one of the ways things could change is you could generalize over a global issue, and then the emotion charge of the whole problem seems to collapse. So sorry, I do have some examples. So you may only have to address a few large aspect of an issue for the whole problem to no longer hold much of a charge anymore. And so basically, I wanted to give you some examples. So war veterans, you think about, they have hundreds of traumatic memories that they've, but then if they only tap on 5 or 6 memories, it is amazing that I've seen this firsthand where the remaining memories seem distant and no longer as painful. So again, they may have hundreds, but you're only tapping on a few, and then it generalizes to the rest of the experiences. A good question to ask yourself is, think of something else that happened, something similar, and does it bother you like it used to? So I know I'm gonna use Wendy's example of a snake again, because I think so many of us have that same pretty similar fear, or lizards. So let's say, you're starting to feel better about snakes. So then maybe she also had that fear for lizards, and then all of a sudden realizes, oh, I don't have as much for lizards either. What happened? I never tapped on that. Again, that's a generalization effect that can happen. It could happen where this was a global, and now, we're able to make it so that it's, you had benefits over many different areas, which is really cool how that might happen. Another thing, talking about like someone that had a fear of flying. Well, what bothers me the most about flying, right? There might not be as much that they can actually think about, because there used to be, like, they would have the fear of, let's say, getting into the actual airplane, or the fear of going down to get the luggage, or the whole somewhere along the process. And then you tap on one aspect of that, and then the rest of the fear of the whole experience could go down, which again would be pretty cool if that could happen for that person. So our generalization effect then, and again, looking at this whole tabletop then, you have a tabletop, which is the issue you're working to resolve. So this one, the example is, the issue is a challenging relationship with my mom. That's an example right there. Challenging relationship. It could be with anybody. The table legs are the events that hold it up. So our idea, which is the events, the table legs, we're trying to knock them down. And then even if you knock down one, maybe two, the whole table would collapse, which isn't that pretty cool? You don't have to knock them all down. And it could actually get that whole entire tabletop to knock down, because you're working on one of those legs, one of those events. So an example of this would be, so if there's an issue, a challenging relationship with my mom, maybe an issue might be about, the where the holiday is going to be, and, the disagreement in, oh, it should be at mom's house or my house, whatever. So if that actual belief could get resolved, knock down one of those table legs, becomes a little bit more wobbly. And then maybe the next time is the issue of, a challenge could be, you should treat your siblings different. And so then if you can get through that type of issue and belief, another tabletop goes down. Pretty soon the whole tabletop goes down. And that issue with challenge relationship with mom no longer really feels like a challenge. There's not really much of an issue anymore, but you only went through a couple of the legs, not the whole entire table. So again, that's another example of that generalization effect. And so we work on many parts, many details, many possible triggers for the uncomfortable emotion we're feeling. And so going through that, recognizing the aspects, tapping very specifically for different aspects, and you might notice that you're feeling that generalization over many different aspects of it. All right, now we're going to get into our video about cravings. So before I do, does anybody have any questions?
From the interpreter, is this captioned?
I hope so.
It's okay.
We will try
wondering.
it. Yeah, I will try. If it's not, maybe Gabby, you could help me. I'm not sure how to do that again. Let me as we play, I will see. All right,
I
so
had a
I'm gonna,
question. Does this work
Yeah.
with just food? I'm sorry, this is Lauren. Does this work with just food, or could it be like craving a cigarette?
absolutely, yes. So there's some EFT, or I'm sorry, some practitioners that are also chemical dependency counselors that use EFT for substance abuse cravings, alcohol, drugs, cigarettes. Yep, absolutely. So Jessica Ortner, I know last time I referenced Tapping Solutions. She's one of the co-founders of that. Her and her brother have founded that. And I could do this with you. I just think it's always helpful to share other resources. That way, you know, it's not just me talking, that there's lots of resources you could go to. So I found this one and I thought this was pretty good. So I'm gonna play it. I think it's about 10 minutes, and make sure you have your item that you want to try not to eat or try not to drink or engage in as she's going through this. So any other questions before I start it? All right.
Welcome to Tapping Down Your Cravings. This is Jessica Ortner. I just finished lunch, and a lot of times when I finish lunch, I have a craving for something sweet. So I thought this was a perfect time to sit down with you and show you how easy it is to tap down a craving. Now, what I would like you to do is find what you crave. I'm sure you have it hidden somewhere around the house. Maybe it's something sweet, maybe it's something salty, but just get it, and you can pause now and grab it. I have my chocolate, my Espresso Escape dark chocolate. I mean, they make it so tempting. Down here it says, moments of timeless pleasure. Okay, so you can see I'm a 10 already. I really want this chocolate. Now what I want you to do is I want you to take what you're craving and I want you to smell it. And a lot of times that makes the craving go up. I'm already at a 10, so I'll smell it anyway just for enjoyment. Okay, so now that you've smelt it, I want you to measure the number. So mine, I'm a 10. I want to rip this open and eat this really badly. So let's do tapping. Okay, I'm going to be tapping on my craving for chocolate. You can tap along. If you don't have a craving for chocolate, you can still get a lot of value. You can still get benefits from tapping along with me. Or just watch this video and use what I'm saying as an example and just implement your own craving and start tapping. It's very simple. You're going to see how easy it is. So we're going to start on the side of the hand, and you can repeat after me. Even though I really want this chocolate, I deeply and completely love and accept myself.
I deeply and completely love and accept myself.
Even though I really want this chocolate,
Even though I really want this chocolate,
I deeply and completely love and accept myself.
I deeply and completely love and accept myself.
Even though I really want this chocolate,
Even though I really want this chocolate,
I deeply and completely love and accept myself.
I deeply and completely love and accept myself.
All right, let's tap on the points. And remember, as we're tapping, it's all about just saying how you feel. So I'm going to tap on the eyebrow point. Say, I really want this chocolate.
I really want this chocolate.
It tastes so good.
It tastes so good.
It's a great way to end my lunch.
It's a great way to end my lunch.
I want this chocolate.
I want this chocolate.
I want my moment of timeless pleasure.
I want my moment of timeless pleasure.
I want this chocolate.
I want this chocolate.
Under the arm, I need this chocolate.
I need this chocolate.
Top of the head, I need to have this chocolate.
I need to have this chocolate.
Back to the karate chop point. Even though I won't feel satisfied until I have my chocolate,
No, I won't feel satisfied until I have my chocolate.
I deeply and completely love and accept myself.
I deeply and completely love and accept myself.
Even though I won't feel satisfied until I have my chocolate,
Even though I won't feel satisfied until I have my chocolate.
I deeply and completely love and accept myself.
I deeply and completely love and accept myself.
Even though I won't feel satisfied until I have my chocolate,
No, I won't feel satisfied until I have my chocolate.
I deeply and completely love and accept myself.
I deeply and completely love and accept myself.
Eyebrow point. I don't feel satisfied.
I don't feel satisfied.
I want this chocolate
I
now.
want this chocolate now.
Why do things that taste so good, why are they so bad for us?
Why are things that taste so good? Why are they so bad for us?
I want this
I
chocolate.
want this chocolate.
I won't feel satisfied without it.
I won't feel satisfied without it.
I need this
I
chocolate.
need this chocolate.
Top of the, under the arm. I need this
I
chocolate.
need this chocolate.
Top of the head. I need this
I
chocolate.
need this chocolate.
Take a deep breath in. Great. I want you to check in with yourself. You can grab what you're craving. Take a little smell. I'm not gonna lie. It still smells good, but it doesn't smell as good. Okay, great. So I know it goes down. For me, it's about a 7 right now. So it just went from a 10 to a 7. I feel a little bit more in control. Actually, it's probably a little bit lower. I could have it, I could not have it, but yeah, I still probably would have it. So let's continue to do some tapping. You know, it's really important to continue to gauge where you are, because you might go from a 10 to a 9 to an 8 and you have to take steps, or you might go from a 10 to a 0. Who knows? But the important thing is to keep checking in and to be persistent. So I'm going to keep tapping on my craving for chocolate. You can follow along. Even though I have this remaining craving for this chocolate,
Even though I have this remaining craving for this chocolate,
I deeply and completely love and accept myself.
I deeply and completely love and accept myself.
Even though I have this remaining craving for this chocolate,
Though I have this remaining craving for this chocolate,
I deeply and completely love and accept myself.
I deeply and completely love and accept myself.
Even though I have this remaining craving for this chocolate,
Even though I have this remaining craving for this chocolate,
I deeply and completely love and accept myself.
I deeply and completely love and accept myself.
Eyebrow point. This remaining craving.
This remaining craving,
I could eat the chocolate,
I can eat the chocolate,
or I could not eat the chocolate.
or I could not eat the chocolate.
But I have a little bit of a remaining craving.
But I have a little bit of remaining craving.
This remaining craving.
This remaining craving.
I've eaten it many times before,
I've eaten it many times before,
and I always enjoy myself.
and I always enjoy myself.
But then I feel guilty.
But then I feel guilty.
Maybe it's not worth it.
Maybe it's not worth it.
Maybe I can have a little piece.
Maybe I can have a little piece.
Maybe I don't need it at all.
Maybe I don't need it at all.
This remaining craving.
This remaining craving.
This remaining feeling of needing it.
This remaining feeling of needing it.
This remaining craving.
This remaining craving.
Under the arm, this remaining feeling of needing it.
This remaining feeling of needing it.
Top of the head, this remaining craving.
This remaining craving.
Take a deep breath in. Doesn't that feel great? It's amazing, because a lot of times when we have cravings, we feel a little bit off balance. Like we need it now, we really want it. And the more we do tapping, the more centered we feel. The more we can make a decision out of using logic instead of just going with our emotion. So I right now feel very centered. I'm going to smell the chocolate again. I just want to test it and make sure that this is working. You know, it's interesting. The chocolate doesn't even smell that good at all. Now I can just smell the cardboard. It's interesting how our senses do change with tapping. So great. I don't have any remaining craving for this at all. And I'm being honest with you here, because I really had a 10. So this is just a quick example of how you can tap for cravings. Now, if you're doing this for weight loss, there's a few things to keep in mind. There might be some feelings underneath the cravings. If you have this impulse to eat, a lot of times there's an emotion. So you can ask yourself, well, actually I would say first stop yourself and ask yourself, what am I feeling right now? What is stressing me out? What am I thinking about? And then instead of focusing on the actual food, focus on that emotion. Once we clear that emotion, you'll find that the craving can go away just by itself. Okay, so I hope you continue to use this. Tap on your cravings. It's worked for me. And you know what's crazy? It still surprises me. I've done tapping for so many things, and every time it works, I'm still a little bit shocked. So continue to tap on your cravings and to ask yourself questions to dig deep and find out what's behind the craving. So good luck, and I will see you soon.
All right, I want to open it up now, and please give me your so many people turn their cameras off. It's because are you eating your candy right now? Give me some feedback on it. I just want to know if you were able to experience any difference in the cravings, not any shifts, anything like that.
I had trouble finding something because my house has kind of been cleared out since I've been trying to lose weight. So I found like a Rice Krispie treat that was in the back. I'm not sure how old it was. So it really wasn't like talking to me, as far as craving. But then when you kind of talked a little bit before, just being somebody who is trying to give up smoking, I did use that, and it did work. And so, like, even though I had originally planned on using my, could be food poisoning Rice Krispie treat because it could be 2 years old, I tried something else. And yeah, but it was interesting because I started with that, and then the smoking came into my head as she was already going through it, and I switched it, and it made more sense. So
Thank
like I had
you.
to switch like halfway, like not halfway through, but within like the first tapping. And then I was like, this isn't really something that I'm really craving. So it wasn't working. And then I tried it and definitely felt a difference.
Thank you.
So I'm wondering, like, even after the craving is gone, and then you still eat it, if it doesn't taste the same.
You have to try it out.
I know.
So, I did do it for the smoking, and I didn't have like cigarettes here to smell because I haven't smoked in over a year since I got pregnant. But with it getting nicer out, those cravings are like pretty strong. Some of that muscle memory is kind of coming. I like grabbed a lighter and it just like, maybe that sound or that like auditory is what I was trying to use it on. But I noticed that I was like tapping harder at certain points. Or like I don't know if that was like a stress reaction or but just certain points as she was going through that I would notice I was tapping like kind of hard. I don't know if that's normal or if that means anything or if that was just me.
No, I think it's great awareness. So much of this process is you taking notes and being aware. Like, wow, why is it that when I was saying this, I noticed I was tapping harder? Like there's probably an underlying emotion attached to that. Then maybe that's the next thing to work on.
I really thought the way that she changed her speech as she went on, as well as giving herself a pause. Like, I need this, I need this, I need this. And how often do we do this? And we never tell ourselves, no, I want this, or it would be nice to have this. And I liked how she did the step down with it. And I could see even the pause in and of itself, a lot of times things will pass. But she made it real important that not just with the tapping, but what you tell yourself about what it is that you want. And that whole aspect of just from a CBT perspective, that it can be helpful. And then I wasn't here for the first one, so I missed that. But I also like the fact that you're doing something, you're moving, and it gives you something else to focus on. And I'm curious to go back and look at some of the research now and see what aspects they feel of the process. What made them put these things together specifically in the research. So
Yeah.
it's really interesting.
So I'm going to ask, did anybody increase their cravings through this process? Because that does happen, right? Like that can actually have the opposite effect. Just like our emotions, sometimes they can actually get worse before they get better. And honestly, that's honestly a good thing because that tells us we've now pinpointed the right thing, right? This is what we should be tapping on. So good. All right. So for me, I had the experience where I have a plastic bag and that's all I smelled was plastic. So when she said cardboard, I was like, I'm the same thing. I'm just smelling now the icky plastic and not the good stuff in the middle of it. So lots of stuff on the internet, on YouTube and other places about the Ortners and tapping into solutions. They have a lot of free stuff. They also, like most businesses, they have also apps you can buy and things, but they do so much free stuff. And I really like her voice. I think it's easy to listen to. I think that's has a lot to do with it too. So I encourage you to look her up and see what you think of it. So thank you guys for participating in that. I appreciate that. Okay.
In
Go
the
on to-
chat, someone
Yeah.
said, dang it, I thought this was going to be an excuse to eat the craving, not do the opposite. And then another person said, I'm a smoker. I kind of did the exact same thing, but I started with cigarettes. So a lot of cigarette cravings.
Yeah. One of the people I'm going through this mentorship with, she does chemical dependency and she does focus a lot on cravings or other stuff, but there's always emotions behind it, right? That's just the byproduct of it, right? And so once you're able to get to the heart of what's happening, and a lot of times our cravings are the same way. We are talking about in the moment, but that's why I'm glad you brought that up, Lauren, because you want to write stuff down, how you may act differently. You may notice it when you're tapping harder, but you might also notice that your mind wonders about a certain situation. You're like, why did my mind go there? Just pay attention to it and see what happens. All right, now we're going to get into cognitive shifts. I talked a little bit about this before, but I really want to get into as far as more the definition of it. So obviously we know cognitive belief is what you think about something, and a cognitive shift then is now you see things from a different perspective. It could be your beliefs may have changed or your thoughts may have changed, whatever. Some examples is that, well, I can understand why she did that now. And so when I talked about before those table legs, the example was issue with your mom. Table legs, then maybe about one of them, I think I gave the example about holidays. And that all that could be is that you're shifting and now you're understanding and maybe, oh, well, now I understand why she did it that way. And so that was a shift then that happened that would then change the emotion, which again a lot of this goes along with cognitive behavioral therapy. The next thing is, well, that actually must have been funny to watch, right? So maybe just changing that shift. And that just seems silly and insignificant now. Like you maybe thought something was a really big deal. And now after tapping, you were able to recognize that you had a shift. And now looking at the whole situation, like, wow, I can't believe I made such a big deal about that. That's just silly. And your mind is able to now have that kind of response instead of the response it used to. There was a shift that happened in the midst of that. So we change our thinking, our attitude, and our perspective. We can tell a cognitive shift has happened because we're able to see the other person's point of view for the first time. So I know obviously we talk about this all the time in therapy. Can I have empathy? Can I see things from their perspective? Sometimes we just can't. Like we know, hey, I'm right, they're wrong. I can't see their perspective. So EFT might be able to help you do that. May be able to help you to understand and have a more awareness about maybe how the other person is seeing it. We might be able to even have more compassion for ourselves, understanding why did I do something that maybe I was really hard on myself and not understanding, and then I do some tapping and I'm able to have more compassion, and maybe have acceptance. I did the best that I could, see the bigger picture, and see ourselves or the problem differently. And sometimes it might feel then it might get worse before it gets better, like I mentioned before. And again, remind yourself when that happens, you actually are tuning in. You might be letting go of denial and allowing yourselves to be present for something difficult, maybe for the first time. because we're really good, aren't we, at distracting and not allowing ourselves to feel uncomfortable things, to let our minds think about uncomfortable things. But as you guys know, most of you with being a therapist is you have to do that in order for there to be a shift, right? And so EFT can sometimes help you really tune in on that to allow that shift to happen. So another part of shifting aspects, then so I talked about the cognitive shifts, the whole thinking that you might look at something different, but there might actually be shifting aspects within that particular event that happened. So, so like, you're talking about that. I'll use an example. So I do not like spiders, and I think I've said that before. I don't like spiders. So, but part of an event is seeing a spider, and I jump on top of a chair because I get so, scared about that, right? So, what part of the event? What part of it happened? The emotion might be fear. The physical location, I feel it in my stomach. My belief is I can't handle being around a spider, right? And so when I have a shifting aspect, it could be that, I had all this happen, but now after tapping, using EFT and tapping, I'm able to see, oh, my emotion, yes, maybe it still was fear, but now I actually don't really feel it in my stomach. I'm more feeling it in my back. And then maybe my belief that I can't handle it has shifted, and okay, it's this little tiny spider. I'm pretty sure I can handle that. So my belief about it, had shifting aspects that change. It can happen to one or all of these in the midst of you doing EFT. But these are just things that might happen as you're going through it. The other thing that can happen is daisy chaining, which is an entirely different event. So I might be tapping on being afraid of a spider, and all of a sudden my mind goes to, whew, last summer when we were on the boat, and that I almost fell out of the boat. Like, wow, how did that go from one to the other? But that can happen often where you have this shifting aspect that somehow you tapped in and did tapping, and then all of a sudden you had this, your brain went to this part to another. And so then you can decide, am I going to go with this new event? Am I going to try to go back to the old event? What am I going to focus on as you go through this? So when it's a completely different event, it's what we call daisy chaining. Then we have our responses. So I think I mentioned this last time. Yawning is actually a great thing when you're doing EFT, which is so strange for a therapist, right? Because we try so hard. We really want to be present for our clients, and sometimes we just can't help it. And we are yawning. So we're trying to hide, yawn, whatever. For EFT, if your client's yawning or you're yawning because you're doing it with them, that's actually a wonderful thing because it's saying your body is releasing. It's a relaxation of posture. Things like belching, laughing, fatigue are all really good signs when you're going through EFT. One thing you want to look for, so that's a good thing. Then you want to look for, okay, if there's maybe I'm increasing the distress in myself and other people, it would be like the shuffling, contraction of posture, the darting gaze, or fatigue that could happen. Again, fatigue I know is listed in both, so you just have to know yourself and your client. But you want to observe this because these are oftentimes unconscious body reactions that happen during tapping. I know the first time that I was tapping and I started yawning, I felt so bad and I apologized. And the person that, was the practitioner was like, are you kidding me? You were giving me a huge compliment that you're yawning. That tells me I'm doing something right. I'm guiding you along the right path because you've had that release. So it's just a different way of looking at it, but that's actually a great thing when someone yawns. Okay, so now I want to talk a little bit about how you use this with talk therapy, TBS, whatever, but how you can use this alongside of the other interventions that you're doing. The biggest thing is the importance of being persistent, is that you want to hone into the most intense aspect to make the difference. Meaning that if that person is telling you that they had, and I'll just use the two examples I had. I had the fear of the spider, and then I also memory of maybe the anxiety about being on a boat because I might fall out again. Okay. So I would always say, which one is more intense? Okay, well, the fear of the spider is more intense. Okay, so that's what you're going to focus on. You're also going to look at not giving up until the suds is a 0. And I know I talked about that before when setting goals. So and that's why sometimes it takes an hour to do this, because you're going to continue these rounds over and over again until hopefully the suds gets to a 0 when you're in the midst of that session. And I know we have a lot of times time limit in our sessions when we're working with people. And so you want to kind of get, better aligned with that. How can I maintain this to make sure I'm going through and keeping them on focus so that way I can continue to move that 10 to a 0 in the midst of this 1-hour session that we're going to have. We're also going to work at deeply versus skimming the surface. Again, being more specific about things. What was the actual event? How can we get real specific about what was actually happening? The more events is not necessarily better. So you don't always want to focus on, well, how many times does this happen and how many times is this bothering you? It's more about, what was the most intense, or when do you feel like you felt this the strongest? What particular one event did this happen? You want to ask open-ended questions to find other aspects as well. And then you want to test. So we haven't gone all the way through a whole session in here just because that in itself takes an hour. But if you watch any YouTube videos or anything like that, or you want to meet with me again afterwards, and I'm happy to do these sessions with you, we will do testing, which is I would actually have you think of the event that we were just tapping on and actually have you do a visualization of the event and test to see if you truly still are that lower suds. And that's a really important part of EFT, is to test to see if you're still feeling that lower suds, hopefully at the end of the session. All right, the apex effect. So sometimes this happens where someone's like, well, yeah, I feel better, but I'm sure I probably never really felt that bad in the first place. It was never really that bad. It can't possibly be because of EFT. It's just because I never really felt that bad, or I never really had that issue. An example here is I can't ever recall ever being afraid of spiders. I know I didn't like them, but I guess it was never that bad. Or I guess my migraine disappeared because you made me laugh. Like, again, it can't possibly be because of EFT. And this, as you guys remember, the term cognitive dissonance that can happen. But this is for EFT is what you call the apex effect, where they have rapid shifts in session, but can't think it could possibly have anything to do with EFT. Now we're going to get a little bit into trauma here. So I want to, let me see on time. Yeah, we're good here. Okay, we're gonna do, and I didn't really practice this a whole lot, but Gabby, how hard will it be for you to make 2 breakout rooms?
Not that hard.
Okay, so actually, can you do 4 breakout rooms?
Is there certain people you want in breakout rooms?
No, it can be random.
Okay.
Okay, so when we do the 4 breakout rooms, what you're going to do is when you are meeting with that 4 group, I want you to think about 2 ways that you think you could apply EFT and get a spokesperson to write this down. And then also I want you to discuss, your questions, like kind of like, this is still woo-woo. This couldn't possibly work, or I can imagine if I tried to do this, this could be an issue that would happen if I started to apply it. So, and again, just get in your groups and then have a spokesperson. We're only going to meet for like 5 minutes and then we'll come back together. So you're going to do 2 possible applications and one possible hurdle that'll prevent you from using EFT. And if you have any questions, we'll kind of go back and forth between to see. That should be simple. Everybody understand the directions? 2 applications, 1 hurdle. Okay.
Okay, so I set a timer for 5 minutes. You guys are going to be pushed automatically into your breakout room. You will get a 60-second warning when your break room is closing. So we can get that warning there. So
Awesome.
we will see you guys here in a second.
Person to take notes.
I can take notes.
Awesome. So what do you guys think? 2 ways you could apply this EFT.
Well, I don't see clients. So I guess I'd have to be on myself or my cat, maybe.
Mm-hmm.
You said pets, right?
Yeah.
I mean, just personally, I have a big fear of the dentist.
Okay.
For that, I also get migraines, so I could probably also use it for that. And I don't know what I could do with my cat. I'll find something to do with him.
I definitely want to try it on clients, but almost all of my clients, I only have 6 now, but almost all of them have PTSD. So I'm like scared that it's gonna elicit something, even though I've been with these people since I started. So like 3 years now, I've seen all these people, but I'm still scared that, I mean, if like I think it'll work or like it'll elicit too much of a response still, or if they think it's whack, right, then it's not gonna work. I feel like if they like, don't have that image or idea that it will work, I feel like it won't work in their eyes anyway.
Yeah, great barrier to bring up. Absolutely. Yeah.
Well, I will disclose that I have done EMDR because of a physical trauma, and it feels a lot like that. Like before, after, or progress, because I have been doing it more when I start to feel anxious about vertigo. And I have seen it kind of, I think it's that cognition shift you were talking about later. So I don't fall down and go boom and break things anymore is what I'm trying to say. Well, I still do, but you know what I mean.
I also don't see clients, so it would have to be more like self-application. I think I would struggle because I wouldn't necessarily know all the different things you're supposed, because like she kind of did different spots at different times, and like the things she was saying was slightly different than what you had said. So like it feels like it needs a script, but it sounds like it doesn't have to have a script. So that would be intimidating for me to be like, am I even saying this right? Is this how it's supposed to go?
Yeah. Good identification.
I think it would be cool to do it with children, especially temper tantrums. And you see a lot of this on like social media where there's conscientious parenting. I think it would be fun to give them that physical release. Does that make sense? And just those self-affirming things. So
So
that's
someone who's like worked with kids, I couldn't see doing it with kids in tantrum because they're such in the limbic part of their brain. But I could see it working well with parents who are feeling like overwhelmed with the kid that is tantruming, to be like, okay, like this too shall pass. You know what I mean? Like you're not a bad parent. Like this is just a bad moment.
and we did. I've worked with temporary. I mean, the physical stuff is what I'm thinking of. Like rather than a quiet room, we've given them like trees to tap on and given them a safe place. And this is just one more progression because you can't take a tree with you everywhere you're going to go. That's kind of where I was thinking. And you're right. It's not for really young children. It's latency age adolescents that are going to punch you instead.
Yeah.
And
So
it's more like,
used to hit herself.
You what?
Oh, I was like, I think my niece would use it as an excuse to like hit herself or hit other things. We let her with no, but maybe that's just her.
So I actually work with ViaQuest Hospice. And so I have been like thinking through my different patients and even like the different level. We work with a lot of people with dementia, and I do think like it depends on like their stage and things like that if I'd be able to actually work with my patients with this. But I am thinking like with family members, especially those who are in denial or like scared of losing their spouse or mom or whoever, like I do think that that could be really really interesting to try to imply it in that way.
Yeah, thank you. I guess we'll go back to the other room. We'll talk more about it. Good discussion, guys. Did everybody get a share? Oh, Lydia. Or is this the other groups coming back together?
Yeah,
This-
sorry. I'm from the other group.
Oh, awesome. Okay.
It should be closing here in a second.
Okay.
So we had 60 seconds left before it forced close.
Oh, that's why. Okay. That's why. Is that why you joined my group? Because you're like, Anne's probably going to touch buttons and.
It was group 1, so I just joined the first group. All right, everybody should be coming back. I think everybody's back.
Awesome. Okay, well, let's just hear from our spokesperson. There should be 4. You could share some summary of applications and then some potential hurdles to application. So start with our group. You know, Kim was our spokesperson, so.
Okay. So most of us, I think, shared that we would probably be using it personally, either for pain or medical issues or maybe anxiety. Some barriers would be sort of being worried about not sticking to the script or maybe doing it not right, I guess. And then we also had a discussion about with clients, some barriers being if they don't buy into the idea or if there's a trauma history, it may not be indicated. And then we also had a discussion about using it with kids, some pros and cons on how that might be a barrier or how it could actually be helpful. So that was what we talked
about. Awesome. Thank you. All right, next spokesperson.
I can go. Letitia automatically nominated me as soon as we got into the group.
Good job, Letitia.
Always bullying me. We talked just more in general terms about anxiety and stress, using it for that. I gave my centipede example of last time. I talked in terms of like cravings, like how that could change, because I said today, since I have like very bad sinus issues, I literally have no cravings. But just in general, the tap in for anxiety and stress, I mean, it definitely works. So we talked about some of the hurdles being the buy-in. Letitia didn't buy in. So I said, maybe that's why it's not really working. But I think a lot of it is just that mindset. I was opposed to it initially, and somebody in our group mentioned just the fear of how you look while doing it. So I said, I know last time we were practicing, I cut my camera off and I felt less anxious doing that. I didn't do that this time, so I felt a little more anxious about the look. So that was a good thing to point out.
Thank you. You reminding me. So recently I saw someone tapping at a stoplight. I was so excited. It's great. See, people around you are tapping and you just don't know it. So anyway. All right, next group.
I can go for our group. So 2 ways that we thought to use it was to just stop cravings. So coffee drinkers, that was a big one in the morning, like replacing drinking a cup of coffee with doing the tapping. Another one was potentially just kind of the opposite, like at the end of the day, maybe like a relaxation technique to just kind of wind down from the day. Or like if you're an anxious sleeper, just to kind of get your mind off of it, to relax. Another example we kind of thought of that I'm just now realizing is fantastic is just with kids. I have a rambunctious 3-year-old, so even just as a relaxation, or he's afraid of thunderstorms, just something simple like that. So those were our examples. And then a barrier that we had thought of was just kind of basing, or exactly what Lynetta said, just the mindset. People don't buy into it. It's really hard to see any outcomes. I'm definitely a skeptic, but I think I'm more so, I have that mindset that I don't know if it'll work. Whereas if I went into it with a mindset like, no, this is going to work, I think I would have two different outcomes. So that was our.
Great. Thank you. And the Latch group.
I'll do it for us. We didn't vote on a spokesperson, but we had a discussion on who's not. And that's okay. All right. So we kind of went toward more like the anxiety side of it as well. Somebody has a daughter that's got some things coming up that were just causing anxiety. So we were talking about it more as a personal use. Wendy, we talked about the quitting smoking, but I did think it was interesting that she said that since she has stopped vaping since yesterday, yay you, but she said it's not tasting as good. Like we were talking about the smells and the taste. Said that it wasn't really tasting that well. So it was kind of like the same general direction with everyone, I think, as far as like an anxiety, like give somebody a break, even just for a minute while you're tapping from whatever you've got going on, if nothing else, and then get them to focus on what they're thinking and feeling about it and get into the roots. So it was interesting. But I don't think we got to a hurdle, did we? We were literally talking, somebody was talking right up until we got cut off.
I know, it's always hard to know how much time it's going to take. So
yeah,
I hope you guys.
Yeah, it was interesting.
Yeah. Thank you guys so much. And there is a lot of similarity, right? People are seeing this, and I'm happy to hear that you're trying to think about ways to apply it. Because the hurdles are going to be there, right? It is going to be like, gosh, can someone see me right now? Yes, okay. They can see lots of things, right? So, but does it matter? But it is a mindset, right? Of getting over that. So, in the buy-in, we are going to talk a little bit about trauma and just kind of the gentle approaches to that. So anyway, I'm going to thank you guys for that. Any feedback at all? Anything else about what we just shared? Okay, I'm going to keep on going because I know it's going to be close.
Oh, I know what I wanted to ask real quick. Can this be a group activity?
Sure, absolutely. Yes.
I was going to say, bringing it to the day programs.
Really, seriously, there's nothing wrong with that. It can be. So the only, not con, it is, you want to make sure that, and I know someone said in our breakout about what do you do when like if a child is overwhelmed, I'm never going to be able to get a child to do this. Well, it's all about practicing, right? And it's all about getting to know the person and also recognizing when maybe they are overwhelming. So if you can get down the side of the hand, and if that's the only thing you're able to teach somebody is this side of the hand, that's a natural calming tapping point. So if that's all they do when they're feeling overwhelmed. So if you do this in a day program, and you notice someone's feeling overwhelmed and you've taught them, let's go back to the side of the hand, and maybe you spend more time on that to kind of help de-escalate if someone does get dysregulated in the group setting. And you're going to want to spend more time actually practicing the points before you even recognize the emotion. So maybe all you do the first couple times, you never mention any emotion. You don't mention anything about how to feel in your body, and all you're doing is just practicing the points. And that's it. Like you don't actually get to, I'm identifying, I'm feeling anxious, and you don't do any of that. You're just doing the points. Once they got this down, when they're feeling flooding or overwhelmed, the points become second nature because you've already practiced them with them. And that can help to de-escalate, especially in a group setting. All right, signs of trauma. So many of you guys already know most of these signs of trauma. the avoidance of situations, no effective strategy to cope, nightmares, disproportionate response, hypervigilance, emotional overwhelm, not new. You guys know the signs of trauma. So for EFT, again, this is what SAMHSA says, first of all. Individual trauma results from an event, series of events, or set of circumstances that experienced by an individual as physically or emotionally harmful, life-threatening, thus lasting adverse effects on the individual functioning in mental, physical, social, emotional, spiritual well-being. I know I just read that to you. I wanted you to know that's a SAMHSA definition. This is another trauma description that is used in EFT and what they call the UDIN, or I've heard it called the UDIN, whatever. But basically it stands for unexpected, dramatic, isolated, feeling alone, no resources, helplessness. So just another way to kind of describe that trauma response has happened. So someone has had, this is called their UDIN, the unexpected, dramatic, isolated, feeling alone, no resources, helplessness. So we look at our big T versus little t. Both of these have all the UDIN elements, which again, the UDIN is the unexpected, dramatic, isolating, feeling alone, no resources. So they both have these, but the little t is non-life threatening, where the big T is potentially life-threatening. Our little t, you still feel isolated, helpless, or overwhelming. The perception is everything. So important factors include age and past history. So it's how they are perceiving something, but they're not having life-threatening. And then you go to big T, which is potentially life-threatening, potential physical injury, physical sexual abuse, accident, surgical procedures, natural disaster, war, victims of crime. A lot more in big T's. So I'm introducing this because I want you to see the difference that in EFT, you are not going to do the big T's until you're certified. You are going to stick with the little T's for EFT, which is anything that's not life-threatening. So a little different for when we're doing cognitive behavioral therapy or cognitive processing therapy, and we have someone rate maybe all the traumatic events they've ever had, and they're going to list like which one's more intense. And we might start in therapy with maybe a higher intense one, who knows? For EFT, you're going to start with the lower intense ones that are non-life threatening. And so it's a little different the way that you're going to go about approaching trauma for EFT. So there's a description between the two there. We're going to look at the trauma pull, which is a phenomenon where there's a pull that can occur as a person recounts an unresolved traumatic memory. And so what happens a lot when someone is talking about the trauma story, all of a sudden their words start speeding up, or they sound a little different as they're talking about the trauma. They can go through the intense aspect of the trauma, and they can actually disconnect from their emotions and physical awareness. So this trauma pull that can happen. And so when we are having someone, if we get to the point where we're having them talk about a trauma, we as EFT practitioners need to get comfortable with interrupting the client and not letting them finish their story. Because what's happened is when someone has this trauma pull, they're not really experiencing the whole trauma, which again, that means they're never going to be able to decrease the intensity of it as EFT believes. So we want to make sure that we're going through every little aspect of it as we're talking with them. Again, just focusing on the little T traumas that might happen. And the abreaction. So abreaction, again, that is a normal but intense emotional reaction. And I think I talked about this before, where someone gets basically like it's flooding, where someone's just totally overwhelmed with their emotions. And a lot of times this can happen when we're trying to stick with the big T, but they end up going to the little T, they end up going to the big T trauma. And so maybe because it's been buried or repressed. And so what you can do is you want to make sure that you're helping them to be able to deregulate. Well, you're going to have them decrease and regulate the emotions that might come up. So like I said, the tapping on the side of the hand is a great way of doing that. Also just kind of going through, this is called orienting tapping, where all you're doing is doing the points and not saying anything else. Or if they're talking and they're having a hard time calming down, you just start doing the points with them and have them do the points as they're talking with you. and remind them to keep tapping. And you will remain calm and collected until it gets to the point where these intense emotions have settled down enough. All right, so I'm going to get into surrogate tapping. So I know I didn't talk a lot about trauma there. So I want to open it up for a little bit. There's a reason I didn't, because the big traumas you can't do right away until you're certified, because there's a lot of trauma techniques for EFT. There's pages and pages. So I'm going through and learning and applying them now, but you as a beginner, you would not want to do that, because you want to make sure that you have them more comfortable with them. But I know a lot of you have clients that are dealing with trauma, and it might just come up. And so I want to make sure you understand that when you are and you recognize someone has a big T trauma that's coming up, you're going to help them to be regulated in the moment. And then you can actually just tell them that we're not going to do the EFT on that. We're going to focus on other things. And at that point, you may put your therapy hat on and do your trauma technique for that. But you won't use your EFT for the big T traumas. So I'm going to open up for questions about anything to deal with trauma, because I'm not going to hit on a lot of it, like I said, for the reasons I said, that you guys are not going to be able to do a lot of the big trauma interventions yet. Okay, no questions about it. We're good to move on. All right. Now we're going to get into our surrogate tapping. So the question is, can I tap for other people? The answer is yes, you can. You can tap for a child, sick person, anyone that would like to receive tapping this way. You can tap on them with permission. Say the words for them as they repeat them, or silently, or listen to the words. So any of that can happen. Surrogate tapping is tapping on your own body on behalf of another person, or again, like you can tap for other people. So this could also be for an animal. So you're imagining that you're feeling what the other person is feeling, and it can be a deeply connective and healing for lots of people. So like I was mentioning, the borrowing benefits. So I've been a part of tapping before where we were tapping with someone that has migraines, and the whole group would tap together for the person that had migraines, and we would get benefits from doing that. The person that had migraines was not tapping because they were not there. They were in a different area. They weren't even part of the room. We were just thinking about their migraine, trying to experience the migraine, and the person started feeling better. Isn't that cool? So again, that's a surrogate tapping that can happen. I'm going to get to some of this more here. All right, so we're going to apply to special populations. The first thing I'm going to talk about is the dogs, or animals in any way. So they're very sensitive to their humans. So you want to work with the human companion's desire for any outcome. So what might happen? Cats, right? So you might in your mind think, I really want my cat to be better. I want this to happen. You have a desire to make this happen. So you want to make sure that that you're thinking about it for their benefit. And just like anything to do with surrogate, you're always going to think about, is this going to benefit the person? And is it for my selfish desire, or I'm really trying to help this animal, this child, this other person by going through this surrogate tapping? So keep that in mind. Most work with animals is not going to be directly on the animal. It is going to be through what we call surrogate tapping. So you're going to tune into the animal's experience. You're going to imagine what they must be going through, and then tap on your own body on their behalf. Because you guys know animals are very sensitive to emotional energy, and they seem to respond well to this kind of attention. So here's an example. So a person has used surrogate tapping with their cat. Their cat was having trouble swallowing pills. So the person tuned in to what she thought her animal might be feeling and tapped on her own body. And then after several rounds, the cat visibly relaxed and took their medication more easily. So one of the ways that they talked through was, even though I really hate these pills, they hurt my throat and chest, I'm a good kitty, and mommy and daddy love me very much. So you do this 3 times. I know I really, and you're thinking about, what is my cat maybe thinking? And you're going through this, and you, okay, hate these pills all the way through. And you would do that your 3 times, and then hopefully it has a different experience for, or your animal is actually able to have that experience. So let's see. So tell me what you guys think about that. Does anybody think they're going to try to tap for their animal?
I think that's where it got woo for me, like the
Yes.
woo woo. Well, I'll try it because I have a very anxious dog, but
So how you
I
would set
know
it up?
Reiki, you can, with Reiki, I know that's one of those things that, can, and I've never tried that either, but, I've heard. So, but yeah, that one sounded a little, I don't know. I'll let you know how Skittles does.
Yes, thank you. Yeah, I agree. This is a little different for me too. I'm still getting there with the animal thing. So, but also, even though it may not affect the animal, it's going to affect you as you're doing it. So maybe it's possible that you're calmer as you're interacting with the animal because you went through this. So there's a lot of things that could come into play with that. But that's one big thing is about with your animals, that you would actually, so you're not going to actually touch the animal. You're going to pretend basically you're experiencing the animal and tap through that. Okay. Next one is talking about with kids, and how do you do this with kids? So infants share an energy system with their mothers. Therefore, it is necessary to work with the parent's desire for an outcome, as it might be a bigger part of the issue. Ooh, imagine that. But remember to work with the parents. The younger the child, the more it is about expressing what happened versus what they feel. And then the use of surrogate tapping toy. And I know I showed my toy last time, my little toy. So this, I'm telling you, with kids, try something like this, like a stuffed animal or something surrogate where they're able to tap on the actual animal and you start getting the child used to that. Because I have seen this and I've definitely read research about using EFT with kids for calming them down, for with fear, anger. And so it's just a possibility. But when you're doing this, you want to make sure that if you're doing EFT with kids, that you are doing it playfully. You want to have a sense of humor and play. It's helpful to be on the floor with the kids as you're doing through this and let them lead the discussion. Keep it simple, stick to the facts, things like this happened. So it's thunderstorming, this is happening, or they took my toy, this happened. Children articulate things differently than adults, obviously. So you can adjust your setup phase, something like, even though this happened, I'm still a good kid. So even though I stole my brother's toy, I'm still a good kid. Something real simple for them. You can use a toy like a teddy bear, like I said, any soft animal or doll, and tap the points on the body. You can also let the child tap on the teddy bear by talking about what's going on, or have the child tap on themselves as you go through this. Encourage the kids to show you intensity levels by holding their hands close together or far apart. So, how much are you feeling the anger? I'm feeling the anger this big, or I'm feeling the anger this big, is a lot better than, I think I feel a 3, or I think I feel an 8. That's going to be really hard for kids, especially smaller kids. So how big are you feeling the anger? And then that might help them to be able to tap on that. Kids are one of those things that you want to, I would, try it, see what happens. But again, you're going to do playfully. You're going to go about it real calm, casually, without expecting a lot of results, and see what happens. You can also try to help them by, let me make sure I have this correctly. Oh, also imagining. So if you have someone here, if you have someone that has physical limitations they cannot tap with their fingertips, or maybe they just can't tap at all. What are some alternatives? Some alternatives is to try simply touching the points by speaking them out loud in your mind as you work through the EFT process. So this actually works for you as well. So even though you know all the points and you know how to get to the points, there might be some times, and I'm adding points so you're paying attention, that you may not be able to or not comfortable with actually being in a meeting and touching all the points, right? But your mind is amazing in the fact that you can imagine that you are touching those points and you will still get benefit from that. So it's the same thing for someone that's not physically able to touch those points. You can help them imagine. Imagine you're touching your forehead. Imagine you're doing this. Imagine if they're not able to do that, and your mind could actually imagine that touch as you're going through that process. And then, so the other thing that can happen is you can help someone to be able to, like I said before, you could actually touch for them if they can't, if with their permission, as you're going through each point, with the intent that eventually they'll be able to imagine and feel that tapping point when you're not there, so they can imagine that tapping point and move forward with it. Okay, I wanted to make sure I had enough time. So let me go back to this one, the physical limitation one, and I want to open it up because I know you guys have questions about that. Many of you work with a lot of people that have physical limitations. What are ideas that you might have or questions you might have about how to apply that?
What if people have range of motion issues?
Yeah, so if they have range of motion issues, you can either help them, like figure out a way to, because you don't have to tap every point, right? If all they can do is stay within this one little area, that's fine. Just like Jessica did her tapping points in a different order than I did, it's okay. You don't, there's no like, if you don't do it in this order, your things aren't going to go as well. It's so, and just like you can't do the full circle, that's completely fine. So if all they're ever able to do is maybe they can do the side of their hand and they can do under their nose, and that's all they do, there's still going to be benefit. Good
That's
question.
kind of a question of mine too, because I know just even with practicing since the last training, I kept forgetting one as I was going down. But then the other thing is I noticed just today, I've been tapping here instead of here all week. And I realized, well, my goodness, since the last training, I've been tapping on the wrong side of my hand. So, does that matter as much? You know what I mean? I mean, I guess if you're hitting, you got to hit the right points, but if you forget one or
right,
like you're not following directions, right?
So it goes back to, remember that one handout about the meridian points and the energy fields, right? And some people are so, especially if you've done acupuncture, sorry, you truly believe that there's certain points, right, in your body that it's essential to hit those points. Yes, that's true. And there's also a lot of research that shows you it doesn't really matter, right? It's more about going through the process and you're helping to identify the event, their thoughts, your body sensations, and then trying to see if you can, your mind is amazing how you could work through that process. So you probably would have still some benefit from tapping on the wrong part of your hand, Stacy. So there's also sometimes people tap in between their fingers. There's lots of different points that you can tap besides what you're learning in this training.
And I think it was, I got it mixed up because I did have a friend who was a chiropractor who, if you pinch in between here, it can help relieve like stress headaches and stuff like that. So I think I just was the two mixed up, but I wanted to make sure, especially because, if we're going to be teaching this to somebody, that if those questions come up, like, what if I miss a spot? What if I don't remember all this? Some of our clients maybe in the IDD don't don't maybe have the greatest memory, or LTCs, where if they don't have their visual and they know they need to use this right now, if they miss a spot, they're okay.
Right. Yes. Good question. All right, so I want to spend some time talking about the next steps and other questions you might have. So this was extremely quick 2-part review of EFT. I've mentioned before, this is like a week-long course that you would take if you're serious about wanting to become certified in EFT, but that doesn't mean you can't start doing some of the interventions. You can definitely start, especially on yourself. But teaching it to your client, you can do that too. Just go about it gently. Use the handouts. You know, if you use the same handout with everybody, that's fine. Again, you're helping them identify an event, an emotion, and are they feeling in their body. And then you're going through the tapping points. I gave you the handouts about how to go through and, you know, go through the tapping points. Yes, you can repeat different reminder phrases that are going through the tapping points. Or you don't, and you just do the tapping. Just try it and see if you get any benefit to it. So the next steps for you are going to figure out, do I want to learn more about this? Do I want to continue with this EFT process, try it personally, maybe try it with a few clients, see if I want to do any more? You know, that just figure that out for yourself. Then look at the research. That was the handouts, right? Look at some of this research. Don't take my word for it, please. Look at the research, see if you like it. If do YouTube videos, you can look up Jessica Ortner, you can look up EFT Institute, International, all the links I gave you, please, and just see what you're learning and if there's different things you like. So I think it's about 2 years ago when I first started with this, I downloaded the app, the Tapping Solutions, and that's what I would use every day, right, is the Tapping Solutions app. And I really loved it and felt great benefit from it. So maybe that's something you want to try, but it's totally, because the nice thing about it is someone else is talking to you. So you're not having to remember stuff, like they're telling you, okay, now touch the top of your head, now do this, right? So it's nice that you have someone do that, but where you take it from here is going to be completely up to you. For us as a company, you can use this as an intervention alongside of, you know, as one of our TBS therapy interventions alongside of that, right? So, but again, you can't use it for big T traumas, only little T traumas. You could try it on your kids, try it on your animals, and see what happens. So those are all things. But the other thing I just wanted to put out there is I am going through certification. So I need practice clients. So if you're like, I would like to do this, then just reach out to me individually. And I'm happy to do that. I'm happy to show you more about it. And, you know, can do that, but it's usually like an hour, you know, you just let me know sometimes. And then see, because doing it being serious about trying it for yourself is how you're really going to know if it'll work or not. So. All right, so now questions, please. We got about 10 minutes or so. So I want to, Wendy.
I know we're talking about using this for like kind of stop bad habits and manage emotion or manage like anxiety symptoms, different things like that. Can it be a useful technique for like wanting to build better habits?
Oh yeah, for sure. You would first start with the bad habit. So even though I have this bad habit, then you could end with, you know, your reminder phrase or whatever would be, but I'm building good habits. Or I'm, you know, whatever you're doing instead. Yep.
Like replacing a food craving or something, like one that was unhealthy with something healthier or something.
Yeah.
Okay.
Is it beneficial to use with, I mean, because all of it is a little bit of emotional regulation. Is it beneficial to use in people with combination of like some DBT skills on, and I'm not saying about the deep underlying trauma, but just as somebody who has a difficulty regulating their emotions in general?
I mean, again, everybody's different. We're all unique human beings. So I could see it being beneficial for that. But you know, you'll know your client.
Okay.
Stacy.
So this may sound like a silly question, I apologize, but so we're teaching our clients this, or we're teaching people this, or ourselves this to do. We're going through the motions, thinking of the things that make us anxious. Is this also something to use when you're in the moment of, like, I'll give an example. I do not, thunderstorms, once there's wind warnings, tornado warnings, things like that, I get terrified. I have had experiences in tornadoes before. So when I see the beep beeps on the screen, or anything like that, like, I automatically go into a panic. So I understand that maybe this is a really good time then to start thinking about that. But is it to prepare me so I'm not as anxious in the moment, or should we be doing the tamping in the moment, like as I'm hiding in the corner of my basement? Should I be tamping? Will that help bring down my anxiety level, or is it more a prep so that I'm more prepared for it in the future?
So I would say all of the above, but in
Okay.
the moment is always the best.
Okay.
Because when you were thinking of an event, we're always trying to be as specific as we possibly can. And what's more specific except when the event's actually happening?
Okay. It was just one of those things, because we've talked a lot about preparing and doing this in like sessions, but then, on your own, like, yeah, and then you can use this, when this happens. So very good. Thank you.
So we talked about ways to possibly apply it. So I know I made you guys share 2 ways, right? So from there, I would like for you guys to, the only way it's going to happen is if you actually try something, right? And if you try it personally, you're going to be able to see firsthand. But if that's too much, or maybe it is, you want to try it with a client, or you want, like, hey, why don't we try to do something like this? Like, make sure you're talking to your supervisor about it, right? Because I'm telling you how, when I'm advising how you might do it and how the client may or may not respond, but you always want to have a clinical supervisor you're talking to, especially if they've had trauma along with it. So make sure you're talking about that in supervision, and you can always reach out to me as well to say, what do I do now? I'm not sure. This is what happened, to be able to help regulate them in the moment. Another way to apply this is to do it in one of your team meetings to take away the stigma, right? If everybody sees Lynetta tapping all the time, they're not going to think it's a big deal. That's right. Look at,
And you
oh,
make so many jokes about it. That's a good point, that in the moment thing, because I find that is when it's most helpful. I got an 18-year-old who still wants me to buy everything. So yeah, I found that in the moment aspect the most helpful, especially in our jobs and management
yes,
all day long.
absolutely. Yes.
Just
Actually,
worried if I do a meeting and everybody's sitting there tapping, that it's something about me.
it's true.
Stacy strikes again.
So I don't remember, and I apologize. Someone in our small group mentioned about they work in hospice, and they thought about the possibility of using this with family members to helping them cope. And I do think that's a great idea. So that's another idea, is not just family members, but maybe staff members that we come in contact with. I'm always looking for ways to help encourage people with their stress, because we know it affects how they treat our clients. And so, giving them ways and tools to be able to help is always a great thing. All right. So anybody want to share what are they gonna do from here? What are you guys gonna do?
I downloaded the app.
Ah, okay.
In the chat, someone said use it for self-care, but I was even thinking, like, I'm sleepy. Like, how do I not be sleepy?
I know it's a release thing, right? So if you're yawning, it's a good thing, I guess. So yeah. Well, I know this was a very short 2-part thing, and I hope you leave her wanting to know more, right? Like that means, hey, maybe this is an interest area for you and I can provide you more information. If you are someone that is really seriously wanting to know more, I'm 100% serious about needing people for practice. And so I'm happy to do that with you. I'm not going to do anything too deep with anybody, but I'm happy to, maybe you're someone that you are afraid of spiders like me and you want to tap on that so you no longer are, or you're feeling overwhelmed by work. It's very much where I have to sign a confidentiality thing as well. So whatever you feel like you might want to try, I'm happy to work with you on that and can provide you more details and think. But it's your call. I don't ever want it to force anybody to do that. So. All right. Any other questions or comments? See things in the chat, but are any of them? Oh, okay. Yeah. Okay. All right. Well, thanks again for your participation. And from here, application is on you if you want to try it, and just reach out if you have any questions at all. Gabby, do you have things?
Yeah. Thanks, Anne. So just a reminder from the beginning of the training, I will be sending out the handouts that were put in the chat, and also I'll be putting an evaluation. We heard some feedback from you guys, so we put it into a PDF format so you guys can just electronically do the evaluation that way and just send it to me that way versus the Word document. So hopefully it's easier for you. It will just say evaluation part 2. I will send it within the next 5-10 minutes to you guys so you guys can complete that if you'd like to complete it today. Please complete it within the next 5 days. So by next Friday would be great. And send that evaluation. If there is nothing else, then we can be done for today.
Thanks,
Thank
Anne.
you.